our hands together for Prof. Sunil.
Okay. Good morning, everyone present here. Today, I am delighted that I am talking in front of you all, undergrad, grad, postgrad students, are scientists, researchers from different parts of the world. The theme of the conference is natural products and human health, right? And we are here to deliberate on different aspects of health and how we can deal with these challenges of our human health with the help of natural products. You know, these infectious diseases and non-communicable diseases, they are becoming a global challenge, big challenge. If you heard that in 2020, WHO recommended, because the situation was so grave, there were no treatment, no hospital, no doctor. WHO ensure if you have the symptoms of corona, you can take azithromycin as an antibiotic. And later, researchers published that there was no use of azithromycin antibiotic. And the consumption of antibiotic, azithromycin, goes huge throughout the world. So, over-the-counter drugs, even in small countries, everyone is doctor. If you have this infection, they will prescribe you, take this medicine. And those medicines are pretty available on all the pharmacies. So what is this? Self-medication. Over-the-counter drugs, rampant usage of insecticide and pesticides. Then adulterants, preservatives in our food items, and toxic chemicals in different industrial process. And the waste material of this industrial waste directly come into our food, water, and ultimately goes the human body. Antimicrobial resistance, as the previous speaker told about the resistance. Very interesting, because I want to keep this talk as interactive instead of giving presentation. One of my family member got a UTI infection. We rushed to the hospital. Doctor gave one antibiotic, no cure. He gave alternative, another antibiotic, no cure. Then the sample was screened. And out of 18 antibiotics, my family member were resistant to 16 antibiotics. This is the grave situation. And similarly, in tuberculosis, we are talking about that we are safe. My dear friends, you will be surprised. Everyone have this tuberculosis bacteria within our body. If our immune system got compromised, definitely we will get the infection. From where we are getting this infection? All from the environment. So antimicrobial resistance and upcoming problem, the environmental resistance, which is a big challenge, and it is unnoticed, required to be addressed well. Social inequalities. Can you see? The slum area in poor countries. Gender difference, gene and environmental interaction, and role of epigenetics are bigger gaps in our health system. And these challenges need to be addressed well at this platform on this third international conference. You know, there are certain factors which create chronic inflammation, and this chronic inflammation result into various kind of diseases. The available anti-inflammatory agent, NSAID, we call it, is basically being used throughout the medical sector, but the side effect of this NSAID and anti-inflammatory agents is huge. If we go by the natural way, we can see the natural product metabolites, they have potent immunomodulator. They are deprived of side effects, or they would create very, very minimal side effects, if I would say. The polysaccharide of aloe vera, you must have known about how much used in cosmetics. The aloe vera polysaccharide, it reduces the pro-inflammatory cytokines, increase in the level of tumor necrosis factor alpha and IgG. Similarly, another food item where we use in our food item, that is Allium stivum, we call it lahasun in India. It enhances the activity of IFN gamma, IL-2, TNF alpha, and interleukin-4, and improve the upregulating activity of natural killer cells. So these are the phytoremedies, which are being used throughout nation since ancient time. But there is a debate between traditional medicine practitioner and present clinicians. Even the clinicians, they follow the same traditional system of medicines somehow in a different way. But they will never say that the traditional system is the best one. I will give some certain examples. Ajadirakta indica, we call it neem plant. It increases the phagocytic activity index and synthesis of nitric oxide. Both are essential in the inflammation. For obstructing two major signaling pathway which cure the inflammation, there are certain plants like Acanthopanax santicos. This is a ginseng, Siberian ginseng. Actinida, you must be well aware about this hardy kiwi plant. Then Anslia fragrans, a Chinese herb. Kayesth occidentalis, and polyphenol from the curcuma longa. Recently, I met a lady. She was so astonished by, she took this herb spice from the conference stall. She didn't know about this curcuma longa. We daily use this curcuma longa spice in our daily meal. This shows a great anti-inflammatory activities. Even nowadays, sir would be knowing well, when we got sick, our mother or grandma, they put small tinge of the turmeric in milk, and we got out of many diseases. Nowadays, in Western world, it is sold in the name of turmeric latte, a glass of milk with many dollars, and it's a small remedy which is being used in India since ancient time. Even though if you got some insect bite, you just apply turmeric powder with oil. It's a very good cure. So even before marriages, this turmeric powder is being mixed with the flour, corn flour, apply on our body to make the skin glowing to the bride. So this is a tradition in India where we use these plants, these herbs, for various kind of infection. Here we are talking about the inflammation. We are well aware about this COVID-19, Ebola, SARS. They are upcoming infection. The problem is that they can transfer from one human to another human. That's why they are potentially as a posing major threat to human health. Antiviral drugs, vaccine, and role of pharmacies is very crucial, and it was much crucial during the COVID time. All over the world, people are looking, China, India, Russia, because these countries could develop vaccine against the virus. But let me tell you, in India, there were people who didn't use any shots of the vaccines. They had symptoms, they got cured automatically. I have one very good example. 95% throat infection are basically due to viral infection. A viral infection will wash away either within 3 days. If temperature persists, next 4 days, our immune system will clear it. If you got a 2-day complete bed rest, lot of fluid, and certain remedies, homemade remedies, which are available in Indian literature, or the remedy is already available in kitchen, then there is no need of any antiviral drugs. But why doctor prescribed? If you have a viral infection, because you can't differentiate between viral infection and bacterial infection. The symptoms would be the common. Why doctor prescribe antibiotics in viral infection? I showed the rampant use of antibiotic even by the clinicians. They know well there is no need of any antibiotics, but still they prescribe. And we became fool. We as a patient have right to ask to a doctor, what is the protocol? What treatment regimen you will follow on my illness? Did you diagnose it? Is it bacterial infection or viral infection? Or to avoid secondary infection? Before, if we don't have any secondary infection, why they are giving? My dear friends, let me tell you, this is my personal experience. What we do, we are living in an area where we can't spare a good time for ourselves. How many of you took rest when you got a sneezing, when you got a common cold? What we do, we got infection, we go everywhere, we spread this infection to everyone. This is a small, healthy practice. If we are not well, we should take rest. We should take good rest at home. It will prevent the infection further and it will cure you better in short time. So, antiviral drugs, vaccine, and the role of pharmacies is crucial, and it was crucial. Such outbreak needs speedy and applicable solution specifically for limited resources. Rich countries, we have seen rich countries, people who have died, whether they have very good infrastructure in healthcare system, like during Corona, and see the situation of those countries where the situation or infrastructure was not good enough. So pollution, which is another a global health related challenge, we are creating pollution here. The ultimate impact would be somewhere else. These challenges can be dealt with the artificial intelligence, new computational methods, and other machine learning technology that can make pharmaceuticals faster. Uh, chemi, chemoinformatics and bioinformatics, now they are playing a wonder in the development of drug. Natural products have gained major impetus for the drug discovery because the new drug molecule, they are very expensive, overpriced, challenging, infective procedure that involve the average of 10 to 15 years for the development of a new drug. But natural products, they are source of plethora of phytocompounds which can be used for the development of drugs. The drug candidate should be a unique feature because plants have a plethora of molecules, but the drug molecule have a characteristic features which make them differentiate or which differentiate them with the other biomolecules. And computational method and machine learning technology make the drug discovery manifold. We will see in few slides next. Ayush and universal health coverage. Do you know what is Ayush? This is Ayurveda, where people use the herbal medicines. Yoga. You must be heard about the yoga. Have you experienced it? Yoga. Unani system of medicine, Siddha, and homeopathic system of medicine. These all together they constitute the Ayush. Indian government have dedicated a separate ministry of Ayush. And we are talking about universal health coverage. Human beings, they are thinking only about themselves, but we have to think about the environmental health, animal health, plant health. That is the universal health. And Ayush can play a significant role for the universal health coverage. Ayush workforce, therapeutics, and principle can augment the healthcare system and to achieve UHC in India. The countries where the population is huge, like China, India, Bangladesh, okay, where the health infrastructure is not pretty good. The present healthcare system is allopathic system of medicine. Everyone be well aware about the allopathic system of medicine. If we club Ayush with the present system of medicine, then it can augment and the problem of health can be resolved easily. Many conventional herbs and plants, medicine, may help to treat Alzheimer's diseases, other neurological disorders. There are many examples, this is an example of ashwagandha can treat the Alzheimer's disease. Homeopathic system. Have you tried the homeopathic system? It is very well connect with the so many type of disease. I have personal experience. My son got, when he was 2.5 years old, he got some throat infection. Doctor prescribed antibiotic course for 7 days. After 7 days, again the infection relapsed. Doctor again prescribed the same treatment for next 14 days. Again relapse. So continuously, more than a month, my child was on antibiotic. I went to a homeopathic medicine practitioner. He gave, when he was 2.5 years old, till when he attained at the age of 12, I never give antibiotic. We use only homeopathic system. But as I told you, children generally got the infection, viral infection, and this homeopathic system is very, very apt for such type of infection. Another incident, I got a wart on my head. I went to the hospital, a clinician. He said, there is no treatment for the wart in allopathic system. And what should I do? He said, I have heard that homeopathic treatment is quite effective for this wart. And it happened, they give me a extract, I applied on the wart. Within 15 days, I was taking bath, I saw there is no wart on my head. So, these treatment, they are quite effective for various kind of diseases. The problem is that the allopathic system, they don't allow, because there would be a huge loss, huge problem for the medical practitioner who do in practice in allopathy. Patients with high-risk case of COVID-19 and SARS-CoV have been treated with the integrated approach of yoga and Ayurveda. It has been well established, it has been well reported in 2-3 years that the yoga and Ayurveda or Ayush system was very, very effective. You know, in COVID-19 situation, we didn't took these antibiotics. Government of India, Ayush Mantralaya, Ayush Ministry, they gave a quath that is known as kadha, quath. That is a herbal mix, and we just boiled it, sip it just like a tea. There is no need of any antibiotic. Practicing yoga can be helpful in depression, anxiety, even cancer, heart disease, diabetic, dyslipidemia, or dementia associated with diabetes. Let me tell you, friends, we are waiting when we will get infection, when we will get ill, we will go to the doctor, clinicians. Better to make ourselves strong. I told you, there is healthy body and unhealthy body. A healthy body cure itself, because we have all the repair mechanism within our body, which will take care of all type of problems, even cancer. I know sartorium, what we call sartorium? Earlier, TB patients, there were no cure, no treatment. Sanatorium. These patients used to be sent somewhere in isolated place, different kind of herbs, fruits, very good diet, open environment, and patient got cured without any treatment earlier at the time of 300 years back. So, practicing yoga can be very helpful. Again, students are sitting here. I saw you people go to the gym, right? I did heavy weight exercise. I did kickboxing, boxing, running, etc. Then I did yoga. There is a huge difference between heavy weight exercise and yoga. Yoga is done with the breathing. Other exercises are done without breathing. We are living because in our body, oxygen is doing work. Okay? And if you can experience it, you just go back to after this class, you just go to your gym or your any exercise regimen, and you start working. And this breathing you should know how to do exercise with breathing. One side you have to inhale, and other side you have to exhale. Even you must be knowing that any trainer, when he or she gives training to his disciple, he always say, control your breath. You must watch in certain movies, control your breath. Even archery competition, you will see, they control their breath. If they don't control their breath, they will miss their target. So breathe is very, very important. And this breathing is all done in the yoga. The disease can be treated with integrated management of Ayush system. Unani system can manage diseases like ulcer or so many advances and challenges in natural products. I think I should go a little bit faster. Vegetable, fruits, spices, they may replace chemotherapy and MDR problem. Why doctors are now prescribing to go with this type of food item with the treatment. Every time doctor will give multivitamin and multiminerals along with the antibiotics. Earlier this regimen was not in use. Why? Even if you cut down the antibiotic and switch over on specific diet, it will cure the problem. Medicinal plant contain antioxidant, antimicrobial, anticardiovascular, anti-inflammatory, anti-cancerous activity. It is reported well. Natural compound act directly on the specific molecular target gene or by indirectly stabilizing conjugate that affect metabolic pathway. 90% diseases are now, today are metabolic disorders because we are quite sensitized that every time we use soaps, the earlier type of diseases like bacterial infection, viral infection, they have come down. But the metabolic diseases, and that only happen due to our lifestyle. So many herbal plants preparation, phytoconstituents, which have a long history in antiviral therapy can play a vital role in preventing infection, including the COVID-19 transmission. Dietary supplement and superfoods are very, very useful in preventing viral infection, including COVID-19. Today, every product is sold in the name of it is organic. It is plant-based, it is natural, but we don't know how natural it is, how organic it is. Okay. So, there are certain examples like glycerin as key active of licorice plant. It helps in replicating inhibition against the SARS virus, chalcones from the Angelia Kayesth against the SARS-CoV-19 protease. Other than this, the other problems in the world are like alcohol, opiates, cocaine, amphetamines, hallucinogens, and illicit drugs. They are another health problems. My dear friends, I don't know what the situation in Brazil, but many countries, the youth, the youth is involved in different kind of drugs in institutions, at colleges, in pubs, bars. Okay, so that is a major challenge, and that can be prevented by greater awareness by individual, families, and society. You know, one quote I always say, we learn a lot from our parents. So that is a training. We need train ourselves, untrain those which are not suitable for the present situation, and retrain ourselves. The training that should be required in the present scenario or present situation. Nanotechnology, I heard that there is a problem with the phytopharmaceuticals, that is solubility, then efficacy, target-based delivery system, but this problem of the phytomedicine can be resolved with the nanotechnology. Omics is a research tool, for example, herb gene protein function, herb host interaction, functional genomics, transcriptomics, proteomics. These tools are now available, which can enhance the solubility, which can enhance the drugs development, drug discovery manifold. So interdisciplinary herbal genome research in conjunction with the large-scale sequencing technologies, metabolomics, proteomics, is critical for the rapid discovery of undiscovered metabolic pathway. I don't know why we are repeating the same thing. Since thousands of years, we have been using traditional system of medicine and people are getting benefit out of it. But our clinicians, our scientists, they will not understand, they will only understand when we have to show experimentally, yes, it works. So in that way, omics can play a major role in the drug discovery. There are other problems, other social factors, social science education and research, where we can see the social inequalities, gender differences, environmental interaction, and role of the epigenetics in the diseases, urban slum, data related to them, even poverty, hygiene, and complex social dynamics are other challenges in poor countries. Slum fosters the emergence of new diseases. People are living in this area. The old disease, we cannot remove them, and then they develop more and more new diseases. This is the biggest challenge. The burden of malnutrition in African countries is another setback and persistent health challenge. Mental health is emerging. Every individual is facing this problem, mental health. Nowadays, we are surrounded with so many technology. These technologies are ultimately creating many health hazards, social hazards, mental hazards. You know, this wire, where we keep our mobile, when we keep near to our body in the night, the radiation, they are creating huge problem to our mental status, mental health. So we all together, we are surrounded with different kind of appliances, and ultimately they are affecting our mental health. So mental health, which is emerging a new challenge, and population with lower socioeconomic status and specifically among youth are affected more. Health equity is more important challenge which need to be addressed now. So early childhood adversities can drastically influence brain structure, cognitive, academic, and behavioral performance. That's why childhood development should be considered strictly for a better outcome. You have seen the childhood atrocities will definitely make a person a gunda, a person criminal. So participation of people in activity related to health for empowerment, effective communication between patient and healthcare, community-based participation research, and a systemic approach to health can predict better outcome of the health. Shifting of, as the previous speaker showed that our government, Indian government, decided a target within till 2025. We may eliminate the tuberculosis from India. But what happened? The shifting of focus to manage COVID-19 has led to various new challenges. For example, the ongoing TB prevention program. For better health, it is essential to give equal weightage to social factor so that all over we can cure many diseases. Hence, education and research focusing on social factor intervention can improve people's health. It is published. With all this, that natural products have so much potential to cure the various health challenges. I am coming on the Indian ginseng, Withenia somnifera, which is a therapeutic and health promoter. Have you tried the ashwagandha or Withenia? You can try, it's very safe. Those who want to do, those who want to do better in their health, in education, then they should try it. It's Withenia somnifera, which is known as ashwagandha. Ashwa means the horse, and gandha means the smell. So it gives a smell of a horse. It's native to India, grown outside other part of the world. All part, either leaves, stem, and the fruit, they are useful, shows the medicinal property. In Ayurveda, medicine is used to strengthen nervous system as a tonic, aphrodisiac, diuretic, antihelminthic, and as a stimulant. So some people use pills to go study at the night, they can use it. But on the same time, it is sleep inducer. It's becoming popular worldwide due to the health benefit, mainly in the stress management, cognitive function, and physical performance. Along neuroprotective protective activity, it is helpful in OCD, inflammation, anti-inflammatory, antibacterial, infertility, sleep disorder, anti-cancer, anti-diabetic, cardioprotective, anxiety, hypothyroidism, muscle weakness, and stress. In these conditions, this Withenia somnifera root extract is absolutely fit, and we can use it. These are the various phytochemicals which play a vital role in different type of diseases. So the pharmacologically important compound which possess 6-membered lactone ring, carbon 8 and carbon 9 position. These are vithophrin A, vithanolides, A to Y, vithanophrine A, vitanone, and different kind of the compound available in the powder of the Withenia somnifera roots. Flavonoids are also present, which include 3-utanoside, quercetin, and different kind of the phytocomponents which are present in the plant. Additionally, vithanolide glycoside, which contain a glucose moiety at carbon number 27, is also present in the extract. Other than these compounds, saponin, coumarin, sterols, and chlorogenic acid, resins, other carbohydrate and fatty acids, they are present in the vithanosides. You must have heard that the Phoenix ginseng, this is the Chinese ginseng, which is sold in China with huge, and they are earning huge money. This plant roots and Phoenix roots shows similar kind of results. So Withenia somnifera has adaptogenic effect. Experimental based evidence showed that the stressed horse treated with somnifera decrease in cortisol, epinephrine, glucose, triglyceride, creatinine, IL-6, alanine, aminotransferases, aspartate aminotransferases, which are responsible for the stress. So this stress can be cured with the Withenia somnifera. These herbal treatment could alleviate glucose intolerance, plasma corticosterone level, hyperglycemia, gastric ulcer, cognitive deficit, sexual dysfunction, immunosuppression, and mental depression. They are a good indicator of the adaptogenic effect. So it is used if you are in different kind of stress, you can take it because it shows a adaptogenic effect. Antibacterial property of the Withenia somnifera, even the previous speaker shows that Withenia somnifera extract is quite effective in tuberculosis, Mycobacterium tuberculosis. Along with this, the Withenia somnifera antibiotic antibiotic activity shows against the Staphylococcus, Enterococcus, E. coli, Proteus mirabilis, Pseudomonas aeruginosa, Salmonella typhi, Cyanobacter, and Klebsiella. These are the major bacterial infection which causes major different kind of the diseases, and all these bacteria can be prevented by this Withenia somnifera. Other than bacteria, there are many fungal diseases like Aspergillus, Fusarium, these fungi are also sensitive with this extract of the Withenia somnifera. Other than antifungal, the antibacterial activity against the P. aeruginosa is quite effective. The mechanism is just, it can damage the plasma membrane of the bacteria. Fatty acid in supercritical fluid from the seed shows the antibacterial activity against the gram-negative Salmonella. So now we have seen that this extract is so much effective against certain bacteria and viruses, bacteria and fungi. Through this conference, I have discussed with Professor Vladimir to test these plant extract against certain viruses, and he has agreed that he will screen this plant extract against different kind of the viruses. The Withenia somnifera also shows anti-inflammatory activity which causes different kind of the diseases, even diabetes, edema, cancer. So Withenia somnifera is quite effective in different kind of these diseases which are basically happen due to the inflammation. It can be used in skin-related inflammation, In a preclinical study, lipopolysaccharide-induced systemic neuroinflammation. The anti-neuroinflammatory effect of Withynia somnifera water extract were reported. So these are all experimental-based evidence where they shows the plant extract, this root extract, shows anti-inflammatory activity. Muscular strength enhancing property of Withynia somnifera. You must have seen that people who are doing gymming, they use so many supplements. Those supplements also contain Withynia somnifera extract and other different kind of the supplements. So it has been reported a significant increase in muscle strength, muscle mass, muscle renewal process by stabilizing a plasma creatine level, increasing testosterone level, and significant decrease in body fat. In athletes, it reported significant improvement in the cardiorespiratory endurance, increase in maximal aerobic capacity, time to exhaust, and ventilatory threshold, and lower level of the serum cortisol, a hormone which is associated with the stress. Significant increase in maximum aerobic capacity, then the placebo group, higher total quality recovery score, increase in antioxidant level, no side effect during the entire study was reported in 2015. So, Vidafrin A and Vithanone were tested on muscle cell differentiation using this cell line, and which shows a strong differentiation of myoblast to myotubes. So, what I am trying to show here, that natural products, they have potential for all these problems. And I'm talking about here this Withynia somnifera, which shows a huge potential in therapeutics. Anti-diabetic activity reported in 2015 by Thakur, where it shows the lower blood glucose level after intake of the Withynia somnifera. It effectively controlled diabetes in rats through modulation in NRF2 and NFB signaling, and therefore has significant potential for the therapy. In silico study confirmed that Vidafrin A can control diabetes. One clinical study shows blood glucose lowering effect of the Withynia somnifera. So what I'm trying to saying is that a single plant, ginseng, Withynia single plant, has this much potential which can be employed. And why I am suggesting you people, you are the future generation, you are the future clinician, you are the future researcher of the world. You should take this phytopharmaceutical natural products as a career, as a research objective for further. Anti-cancer property of the Withynia somnifera, which has reported in many studies, which indicate that it can cure different kind of the cancer, and then effective against harmful radiations, oxidative stress and inflammation in the liver, spleen, tissue, and can be used to protect the vital organ against the radiotherapy. Where in cancer we are giving the radiotherapy along with cancer therapy. If root extract of this Withynia somnifera is given, then it is quite protective in nature. Vithanolide, Vitafrin, Vithanone, and Vithanoside reported effective against the different kind of cancer cell line. Study reported in vitro cytotoxicity in 50% ethanol extract of root, stem, and leaves against 5 human cancer cell line. So it is quite effective in the liver infection. Here study report that albino rat with myocardial necrosis induced by isoprenyl treatment, a decrease in glutathione level and a decrease in activity of superoxide dismutase, catalase, creatine phosphatase, and lactase dehydrogenase. Decreased lipid peroxidation level was reported. So it is quite effective even in the this liver infection. Rat induced with the cardiac ischemia caused significant myocardial necrosis and oxidative oxidation imbalance and increase in lipoperoxidation. A study showed how it is effective in the liver disease. Cardioprotective property of the Withynia somnifera, as I discussed, it is quite effective even in the neurodegenerative diseases like Alzheimer's diseases and Parkinson diseases, Huntington diseases. Even if a person have the OCDs, in that situation, the Withinia somnifera is quite effective. COVID-19 and Withinia somnifera, it antiviral property against the hepatitis C virus. Sir, it has been reported, we have to check again the Withinia somnifera in your laboratory. The antiviral property against hepatitis C virus was also reported moved in 2020. Immune, homeostatic, inflammatory, regulatory, pro-inflammatory, cytokines, inhibitory organs, protection, stress prevention, anti-hypersensitivity. So all different kind of diseases can be cured by the Withinia somnifera, which has been reported well in literature, so which I am showing here. Now, the safety of Withinia somnifera, there are certain concerns about the safety of the Withinia somnifera. The first case of Withinia somnifera toxic effect to liver was reported in Japan 2004. And the patient recovered from it after withdrawal with symptomatic treatment in just a couple of weeks. This is one report. I'm frankly showing you. Case of hepatotoxicity was in a 39-year-old woman, and she was diagnosed with jaundice, nausea after consuming Withinia somnifera root extract. Severe liver toxicity was observed in 41-year-old woman when she consumed Withinia somnifera extract with progesterone. Although these reports claim the hepatotoxicity of Withinia somnifera, but these are not sufficient indices for the toxicity claim of the Withinia somnifera. On the contrary, there are scientific reports which claim no toxicity at all. 80 fully healthy individuals were subjected to Withinia toxicity test and no toxicity was reported. Verma et al. 2021. 18 volunteers confirmed no significant change in level of health parameter. On the contrary, there was an increase in serum creatine level and a decrease in blood urea nitrogen level, indicating an increase in the muscle mass during the study. Despite it may benefit, it is advised not to take Withinia somnifera during breastfeeding and pregnancy. Highest dose of 2000 milligram per kg per day was administered to a pregnant female rat. Highest dose, 2000 milligram. And no toxic effect, no change were observed in the body weight of the pregnant female, the number of corpus luteum or the embryo implantation. Furthermore, no external skeletal or visceral deformity of the fetus were detected. So in these studies says it is quite safe. At the end, the preparation are not recommended for all patients without controlling other therapies. If you are on different kind of therapies, you should seek help of a clinician, Ayurvedic practitioners. A patient with hypothyroidism should avoid Withinia somnifera, although it have proven efficacy in relieving the symptom of hypothyroidism, as it may exacerbate the effect of disease due to increase in the concentration of 3,3,5-trimethylthyroid T3 and T4 level. Used in treatment of male infertility, however, men with hormone-sensitive prostate cancer should avoid due to the increase in testosterone production. The higher dose of extract may also lead to miscarriage in women. So these are, and even the people who have been prescribed benzodiazepine or barbiturate drug, which are used for the heart disease and other, should avoid the therapies. Root extract or the Withinia somnifera root extract may interact with the preparation for anti-anxiety, sleep, myorelaxant and sedative, and exacerbate their effect due to the synergism. So it should not be taken with anticonvulsant, barbiturates and benzodiazepine to its addictive effect and show impaired motor coordination, muscle weakness, headache, and different kind of the symptoms. So based on the above discussion and reports, it can be concluded that Withinia somnifera is safe plant to be taken for a different type of the health benefits. So in conclusion, my topic was, I am here advocating the natural products for the better human health. So natural products, especially the plant products, have a plethora of secondary metabolites which are being utilized for health purpose in traditional medicine system since thousands of years. In India, a rich legacy of Ayurvedic system or other traditional system is being in practice since ancient time for sustainable development and for a better healthcare system. Natural products or plant secondary metabolite research should be encouraged for mankind in health, agriculture, environment, and food industry sectors. W. somnifera is also used for 3,000 years back in Ayurvedic medicine, and the research has proven its credibility in health science due to its multiple benefit in different type of the body system. Although much more is known about W. somnifera, more studies are needed to confirm its potential therapeutic uses and to determine the optimal doses. So this is all about the Now, I would like to say thanks to the organizer, Professor Anna, her team, and all my dear friends and young scientists, budding scientists, doctors, clinicians over here, and academicians, that this conference gave me an opportunity to present a review type of work here. The theme was, because if I present my own research work, it would be very small. I am here to advocacy about the natural products and human health. Friends, it's today we have to take care of ourselves as well as the upcoming generations. So that's why, to avoid all the synthetic chemicals, synthetic products, we should go organic, we should go natural products. Thank you so much.
Thank you, Dr. Sunil, for the comprehensive comprehensive talk. It was very, very informative, but due to time factor, I think if you have any, it's okay, if you have any questions, I think can ask during the breaks, okay, during the lunch break or during the tea break. And so I will pass to the next session after this.
Okay, so we are going to have our break now, and we shall be back here in 15 minutes, all right? Thank you.